Hello everyone, my name is Brendan and this is my new drug project on Ongentys. Ongentys is a drug used for patients during off episodes with Parkinson's disease. Off episodes are times when the PD symptoms flare basically, even though you're still taking levodopa and carbidopa. Symptoms of this are tremors, bradykinesia, muscle rigidity, Parkinsonian gait, face masking, and slowed reactions. Ongentys has an active ingredient called opicapone, which is a selective and reversible COMT inhibitor. COMT is catecholomethyltransferase, which is an enzyme that degrades dopamine and other catecholamines. So by inhibiting this, Ongentys allows more levodopa, which is synthetic dopamine, to reach the brain and hopefully help with the Parkinsonian symptoms. Some adverse effects of Ongentys commonly seen are dyskinesia, constipation, an increase in blood creatinine level, hypotension and fainting, and weight loss. The more severe possible side effects, which were rare but still present, were falling asleep during normal activities, even some things such as driving, and this would happen without feeling tired or drowsy beforehand. Hypotension or dizziness, which could result in fainting and falls, auditory or visual hallucinations, and impulse control and compulsive urges. Some nursing tips for everyone. Ongentys is to be taken as one capsule and is taken at bedtime every day. And then opicapone has to be given with levodopa and carbidopa. Does not need to be given at the same time, but if you are not taking levodopa, then there's no reason for you to be taking opicapone. So they have to be taken together. MAO inhibitors are very bad with Ongentys. Basically, they both inhibit catecholamine metabolism, which then leads to increased catecholamine levels in the body, which then increases the risk of arrhythmias, tachycardia, and drastic blood pressure changes. As far as pregnancy risk, there was not enough adequate data for human pregnancies, but there were some tests done on certain animal populations, and those resulted in an increased incidence of fetal abnormalities. So if you are planning to get pregnant and have Parkinson's, I think you should advise your patient to not take this or talk to the doctor more so. Teaching patients to change positions slowly due to the side effect of hypotension. So just little things of leaning when you get out of bed, sit on the side of the bed for a couple minutes and then stand up. And then patients should not drive or operate heavy machinery due to the risk of falling asleep suddenly. So that is a big one. That was on the severe side effects, so that is definitely something to kind of grill into their brain. For a memory aid, we're going to go with some alliterations here. So use Ongentys for when Parkinson's is on. So just on, and on. And then if you have Parkinson's and you're off, use Ongentys. So like a light switch, flipping on and off. And it's kind of opposite, similar to the first. And then this one's a little more rhymey. Opicapone picks a bone with tremors. So opicapone, the active ingredient, is going to pick a bone or fight with the tremors and disable them. All right, here is the NCLEX question. You are completing a follow-up with a patient with Parkinson's disease who has been taking opicapone Ongentys for the last month. Which comments made by the patient revealed that more patient teaching is required? Select all that apply. A. I take one capsule each night before going to sleep. B. Sometimes I fall asleep during the day. Hasn't affected my driving though. C. Whenever I'm feeling down, I know I can take my good old phenelzine. D. I take my levodopa every day along with my Ongentys. E. When getting out of bed, I sit on the side of the bed for a while before standing. Pause here to do this on your own, and then we're going to go over the answers in just a second. So here's the answers and rationale. So the correct answers are B and C. So we're going to go through all the answers real quick and see whether they're right or wrong. So Ongentys should be taken each night as one capsule. The patient should not be driving due to the risk of falling asleep at the wheel. Phenelzine is an MAOI, which interacts with Ongentys, resulting in cardiac arrhythmias and tachycardia. Ongentys should only be taken while also taking levodopa carbidopa. And due to the side effect of hypotension, patients should be slow to change positions to decrease the risk of fainting, resulting in a fall. So this question fits into the application analysis level of Bloom's because you have to understand the side effects of the drug as well as translate the patient's comments and compare them to the side effects and look at the situation as a whole and see what the patient does or does not know. Here are my references. Thanks for watching. Have a good day.